Hello, ma'am. Good day. I am Patricia Antiga Sulga from BSN 12J. So for today, I will be going to perform the return demonstration in perineal flushing. The purpose of this is to remove normal perineal secretion and colors and also to promote client comfort. And this is to prevent infection or contamination from the rectum. So now I'll be going to start my procedure. So first is prepare all the needed materials. Our materials to be used are solution bottle. We have here cleansing solution, which is the povidone iodine betadine vaginal Dutch. And of course, we have gloves, sterile gloves. We have assuming that these are kidney basins. Next, we have bedpan. Here, our bedpan. Of course, 2 forceps for the cotton. Here. Next, we have our draw sheet, our rubber sheet, and also our blanket. So, these are the materials to be used in perineal flushing. Next is washes hand. This is to deter the spread of microorganism. So next is wear gloves. This is for infection control. So prior to performing the procedure, introduce yourself and verify the client's identity using the agency protocol and explain to the client what you are going to do and why it is necessary. The rationale for this is to let the patient understand the procedure and also to gain patient's cooperation. So hello ma'am, good day. I am Patricia Antiga Silga from Davao Doctors College and I will be your student nurse for today. So today ma'am, mag-perform taog perineal flushing. But before that, may I know your name, ma'am?
Epi Iris Bigit Sulga.
Your birth date po.
May 20, 2007.
Patanaw ko sa wristband, ma'am. Thank you, ma'am. Kung sino gusto itawag na ko sa mga ma'am?
Iris.
Okay. Hello, ma'am Irish. Karon is mag-perform taog perineal flushing. So, there are times, ma'am, na need na ako mugunit sa imuha, ma'am. Mangayo lang at akong permission, ma'am, if it is okay po.
Okay.
Okay, ma'am. Thank you. Then, provide for clients privacy by closing the screen or the door. I already closed the door to protect our client's dignity. So, next is position the patient on dorsal recumbent. Back-lying position with the knees flexed and spread well apart. This is for patient's comfort. So next is cover her body and legs with the bath blanket position. So corner is at her head, then the opposite corner at her feet, and the other two on the sides. Place the rubber sheet or draw sheet and bedpan under the patient's buttocks. This is to prevent the bed from becoming soiled. So, drape our patient, exposing only the genital area. So, assuming that this is our rubber sheet. Next is our draw sheet.
$9.52.
And our bedpan. So, drapes the patient, exposing only the part to be cleansed. This is minimum exposure lessen the embarrassment and helps to provide warmth. So, inspect the perineum, then flush the perineal area with warm water. Note particular areas of inflammation, swelling, excessive discharge or secretions from the orifice and presence of odor. Then, warm water is used to prevent chilling and often or dissolve blood clots. Here is our solution water. So, get 7 pieces of cotton ball soaked in a cleansing solution using pick-up forceps. This is to maintain sterility. So, this is our 7 cottons soaked in a cleansing solution. With the second cotton ball, cleanse starting from mons pubis in figure of 7 by way of external labium towards the anus, then discard. The rationale for this is secretions that tend to collect around the labia minora facilitate bacterial growth. So next, do likewise on the opposite side with the next cotton ball.
Kuya din.
So, from mons pubis to the labia majora down to the anus and discard. And on the opposite side, from the mons pubis, labia majora to the anus and discard. With the fourth cotton ball, cleanse starting from mons pubis in figure of 7 by way of internal labium towards the anus and discard. Do likewise on the opposite side with the next cotton ball. So next is for our fourth cotton ball from the mons pubis to the labia minora to the anus and then discard. Do it on the opposite side from the mons pubis to the labia minora and then to the anus and discard. With another cotton ball, cleanse groin starting from groin going up the thigh and then use another side of the same cotton ball for near groin. So for our sixth cotton ball, we will start from the groin down, up without returning to the groin. Then discard. Do it on the other side. Then discard. So next, flush perineum thoroughly with sterile water. Using 7 dry cotton balls, dries the perineum with the same stroke as above, which are the procedure 8 to 13. The rationale for this is moisture support the growth of many microorganisms. So this is our cotton balls. So from the mons pubis down to the midline of symphysis pubis to the anus and then discard. From mons pubis to the labia majora to the anus and then discard. And then repeat it on the other side from the mons pubis to the labia majora, then to the anus, and then discard. And then from the mons pubis to the labia minora to the anus, and then discard. From the mons pubis to the labia minora to the anus, and then discard. From the groin, down, up, down, up. To the other side, from the groin, down, up, down. So, remove the bedpan gently and turn the patient to side. Ang tanggalon na ako, ma'am, ha. If necessary, take one cotton ball and cleanse one side of the buttocks, then clean the other side of buttocks and dry both buttocks. Ma'am, pa-side ko, ma'am. Thus, after care of the materials used, remove and discard gloves and perform hand hygiene. So, record the treatment done to patient and any unusual findings such as redness, excoriation, skin breakdown, discharge or drainage, and any localized areas of tenderness. The rationale for this is for documentation purposes that procedure was done and means of communication. So, there are no discharges or drainage. So, the type of leukemia, there are no signs of leukemia, and my procedures are done very well. So, that's all. Thank you.